Originally, 17 patients were allowed entrance into the program, applied, and gained acceptance into the program. And once a lot of patients realized that they could go the same route to obtain medical marijuana, the federal government under the Bush administration closed applications to this. Currently, there are 4 patients still alive who are grandfathered into this program. And each of these patients receives or can roughly 300 pre-rolled joints per month, paid for by everyone in this room, our federal tax dollars at work, grown in Mississippi and shipped to them, to the pharmacists where they pick it up. Clearly, the federal government knows, whether they publicly acknowledge it or not, that marijuana has medical value, and they've known this for some time. In addition, well, I'll skip this marijuana part since that's been talked about. Let's see. Okay, about smoking marijuana. As was mentioned before, the IOM has come out saying that long-term smoking of marijuana for medical use is not recommended. However, they do say that in the short term, except for the harms associated with smoking, the adverse effects of marijuana use are within the range of effects tolerated for other medications, and that the short-term immunosuppressive effects are not likely great enough to preclude a legitimate medical use. President Clinton's administration unfortunately did not act on this report, and marijuana has remained Schedule 1 to this day. Research continues, including lines recommended by the IOM report. For specifics on the latest clinical research, please refer to the booklet entitled Emerging Clinical Applications, which has been provided to you. On the topic of smoking, one has to realize that with the advent of vaporization, the problems associated with smoking vanish. In comparison, vaporization offers a number of advantages. Most important is the lack of combustion gases, such as carbon monoxide. Just as important is the fact that it is just as effective as smoking. According to a study conducted by Dr. Donald Abrams, California, vaporization of marijuana does not result in exposure to combustion gases, and therefore is expected to be much safer than smoking marijuana cigarettes. The vaporizer was well tolerated and preferred by most subjects compared to marijuana cigarettes. The Volcano, which is a specific type of vaporizer, is an effective and apparently safe vehicle for THC delivery and warrants further investigation and clinical trials of cannabis for medical purposes. In addition, just as with smoking, patients are able to control their dose via titration, stopping once they feel the desired effect. This ability to directly control how much of an effect you want is something that pill medications such as marijuana sorely lack. Now, briefly, I'd like to go over the personal reasons why I'm here bringing this to your attention. I personally know in my family alone at least 3 people who could receive benefit from medical marijuana. For instance, my grandmother, 83 years, has rheumatoid arthritis in her knees and knows that medical marijuana is effective at easing her aches and pains. More telling and more heartbreakingly, my father. He was diagnosed with reflex sympathetic dystrophy, also known as complex regional pain syndrome, in 2003. RSD is an ailment characterized by severe burning pain, pathological changes in bone and skin, excessive sweating, tissue swelling, and extreme sensitivity to touch. This leaves him in almost endless and random pain. Neurological signals get crossed, and regular touch can feel like agonizing burning pain. He's been prescribed every pain-killing narcotic under the sun, going so far as to undergo a 5-day experimental ketamine drip treatment in Cooper Hospital in Camden. This treatment required a year to work through the red tape simply to get approval, including trying other treatments first, and in the end it didn't even work as expected, or as hoped. My father has not been able to leave the house and visit me in my apartment since 2004 because the drive affects the condition too much. He can't get out to the movies, family functions, or anything else that he used to do. The narcotics that he's still prescribed now make him extremely tired, constipated, and loopy, and create problems over and over. He has one of the worst cases of RSD known to his doctors, and his history of treatment includes the following. In 2002, he had physical therapy, cervical epidurals, and acupuncture. He had, in 2003, nerve root injection and carpal tunnel injection. And the carpal tunnel was the condition that led to his RSD condition. He had sympathetic nerve blocks, which are devices meant to block nerve signals from reaching the brain. That didn't work. He had stellate ganglion block. I'm not even sure what that is. In 2003, he had quantitative sensory testing, where they do a a serious test of all physical responses. He had inpatient stay with intrapleural catheter with bupivacaine for 3 days. In 2004, he had an IV with lidocaine and Hickman catheter for 4 days. In 2005, he had the inpatient stay for 4 days with an IV drip of ketamine, which was an extremely bad experience, and all the other procedures did not help at all. At many points during his treatment, it was at times impossible for him to hold a conversation with me or my family without these horrible pharmaceuticals affecting his memory, speech, and ability to stay awake. His history of prescribed medicines includes the following: Pamela 10 milligrams didn't help. Neurontin 300 milligrams made him spaced out. Percodan and then Percocet both made him tired and constipated and only helped a little. Paxil 10 milligrams didn't help. A fentanyl patch, which is probably the strongest narcotic pharmaceutical you can even get, didn't help and caused an allergic reaction. OxyContin, Ultram, Pamelor, and Neurontin at the same time. Colace for constipation. MS-Con, which is morphine, didn't help, and larger doses than 15 milligrams caused reactions. Xanaflex, Lexapro for depression, oxycodone, Valium, Wellbutrin, and Zoloft for depression, which, as you may know, can result from serious conditions. Lyrica 50 milligrams made him tired, and eventually he switched over from morphine to Opanadol. I find it incredibly hard to believe that marijuana should continue to be prohibited when all these other medicines did almost nothing good. When I did some research, I found that marijuana could seriously raise his quality of life. After trying it a few times in various forms, he noted that it does help him. Other RSD patients I've spoken with have been able to wean off of the heavier narcotics after using medical marijuana as part of their regular regimen. My father, on the other hand, does not want to break the law and risk going to jail. It's simply not an option for him to go to jail for some of his conditions. And he refuses to use medical marijuana as part of his medical regimen until it's legalized, even though it could significantly raise his quality of life now. He doesn't want his family members to risk breaking the law to help him either, not with the insane penalties associated with possessing marijuana under prohibition. Worse yet, if he were to use medical marijuana anyway, he could lose access to his pain management doctor if he were to test positive on a drug test. And as you may know, cannabinoid metabolites can last in the bloodstream for up to 30 days, for up to a week after single use, up to 30 days after repeated use. Insurance companies and doctors who work with them don't cover people who use marijuana, even if they use it as medicine. It's a catch-22 that is simply unacceptable. At this time,